Good, happy Friday morning, January 29, 2021. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin. First up, we're going to begin with COVID-19 updates. COVID-19 in New Hampshire, what you need to know. Let's take a look at that information for all of you right now. And here is a look at that information for all of you right now. There are 64,258 number of people in New Hampshire have tested positive for COVID-19. 25,686,826 number of people in the United States have tested positive. 1,022 number of deaths from COVID-19 in New Hampshire. 222 current number of hospitalizations for COVID-19 in New Hampshire. And 289 number of deaths from COVID-19 in the United States. Now let's take a look at this map of New Hampshire where current cases of COVID-19 are. In Nashua, 480. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Nashua, 5,675. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple, daily new positive COVID-19 cases. Orange, new hospitalization, and red, deaths. Let's take a look at this chart here. Current cases in the purple, total current COVID-19 cases. Orange, current hospitalization. And let's take a look at this chart here. Total cases in the purple, total positive COVID-19 cases. Orange, total hospitalization, red, deaths, and blue, recovered. And let's take a look at this chart here. Positive PCR test rate, positive PCR and antigen test rate, and daily PCR tests. Let's take a look at this chart here. Age group cases and female and male cases. Let's take a look at this chart here. Infections, hospitalizations, and deaths. And let's take a look at this chart here. Deaths, percent of New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Fire at Meredith Marina destroys service building and multiple boats. No injuries reported. Officials say building fully involved in fire. Let's take a listen to that video from WMUR News 9.
Over the past year, our local New Hampshire businesses have shown amazing resiliency. They've gone the extra mile to do whatever they can to make sure their doors stay open for us. Now it's time for us to go the extra.
There was a loud explosion, and seconds later there were flames shooting in the air. And as we watched, the flames seemed to go higher and higher. God, I couldn't believe how high the flames were shooting. And then we heard another explosion.
Police cars just started racing down the road, and the next thing we knew, we could see black smoke billowing from, one of their buildings.
Meredith's fire chief says they received a call for a building fire around 4:45. Minutes later, they worked to contain the flames to a 50 by 50 foot structure.
Fully involved in the front, blowing fire, with exposures on all three sides. We was able to contain the fire to the service building, which burnt, and is a total loss.
Chief Jones says in addition to the building, 4 boats were destroyed and a couple others have heat damage. He says no one was inside the building at the time of the fire and no one was hurt.
All the workers and staff at the time had gone to the administration sales building for a meeting.
The fire chief says Meredith police are interviewing the workers to help determine the cause of the fire. Neighbors watched it all unfold safely from across the lake.
Those flames were not just in that area, they were to the right, from my view, It looked like they went the whole width of the marina. It took them a while to get the thing controlled. I mean, that flame just kept growing and growing for quite some time.
Meredith's fire chief says some oil and gas did reach the lake. They have notified the state's Department of Environmental Science. In Meredith, Jessica Moran, WMUR News 9.
Okay, and there you go on that video and that report. State sending text messages, emails to Phase 1B group to ask if appointments were scheduled. Let's take a listen to that video from WMUR News 9.
Quirk works for you at Quirk Kia in Manchester. Our dealership at your doorstep. This month, you can lease the new 2021 Kia Sportage LX for just $129 a month. And Quirk will deliver to you. Visit QuirkKiaNH.com.
Retired Dr. Bart Curinelli still doesn't have a vaccine appointment.
1 minute I'm saying the hell with it. If you want me to die, I'll die. It's frustrating as hell.
The 87-year-old from Londonderry says he started trying to register last Friday. He's reached the 211 call center, received daily emails, including the newest one.
This email is to check to see if you've been able to get an appointment. We'll send you a following email where you can answer us. I couldn't even answer this email.
He's hoping after 40 years in family medicine, the next email will help him get one appointment for himself for his vaccine.
Well, I'll just have to wait till March and April, I guess. And if I die, I die, I guess. You know, I'm not looking for special treatment. I'm just looking for treatment.
I was dancing around the kitchen when they found out I was going to get in.
Nancy Farrell was thrilled when she learned she would get the vaccine. Her doctor told her paperwork was submitted on her behalf, but still no luck locking down an appointment.
People are waiting so long to get in now. So it's just frustrating waiting. Just like to have an answer, even if it's in April, at least they'll have an end in sight.
Once again, look for a text message or email asking if you need more help scheduling an appointment. You must respond within 24 hours, and after 24 hours, you'll only be able to get in touch with them by emailing this address, covidvaccine@dhhs.nh.gov. Live in the studio, Jean Mackin, WMUR News 9.
Okay, and there you go on that video and that report. Some Granite Staters face challenges getting to COVID vaccination site. Communities come up with plans to help people get vaccinated. Let's take a listen to that video from WMUR News 9.
Over the past year, our local New Hampshire businesses have shown amazing resiliency. They've gone the extra mile to do whatever they can to make sure their doors stay open for us.
Local firefighters are vaccinating some Lebanon Housing Authority residents. The Phase 1B clinic, coordinated by the Regional Public Health Network.
We kind of did a little happy dance, and the residents have just been so thrilled.
It's one of the closed pod clinics for people in congregate settings. Seniors living independently, though, are on their own, at least for now.
Individuals living in their homes or their apartments who don't have that luxury are still in need of getting to the location.
Portsmouth's senior coordinator says the closest state sites are at least a 20-minute drive.
The Exeter location is not served by public transportation at all. Thankfully, the Dover location, the C&J bus stop, is served by Coast Bus number 14. However, it's not super easy to get on bus number 14 if you're not in the right location in Portsmouth.
They can provide senior transportation to the bus stop.
Or as a backup plan, the Senior Services Department, myself, the department being me, is offering rides in our recreation van, and I will bring you to your location, whether it's Dover or Exeter.
Grassroots efforts likely in other communities, too.
We do not want anyone missing their vaccination appointment due to transportation.
Dr. Beth Daly of DHHS says they are working to implement processes to help bring the vaccine to homebound senior citizens, as well as those in settings like independent living facilities. But they don't have that information ready to make public yet. We're live in Portsmouth. Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. Some who recover from COVID-19 face lingering symptoms for months. Brain fog, pain, heart injuries, and persist for some. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
Over the past year, our local New Hampshire businesses have shown amazing resiliency. They've gone the extra mile to do whatever they can to make sure their doors stay open for us.
During a virtual meeting with New Hampshire healthcare providers, state epidemiologist Dr. Ben Chan talked about the health issues people may deal with after recovering from COVID-19. He talked about results from a recent study.
Anywhere from sort of generalized symptoms of fatigue and malaise and having myalgias and, arthralgias, joint pains, all the way up to, people reporting heart or myocardial injury.
Dr. Chan says people may also experience mental health issues and more.
There's been concerns around brain fog and issues of mood and emotional health. And then what I think a lot of people have been talking about also is, long-term pulmonary function and the impact of COVID-19 on the lungs.
Some people here in New Hampshire who spend time in the hospital for COVID-19 are experiencing some of these symptoms right now. Some are mild, but others are severe.
Fatigue was unreal. I was so tired to even do a load of laundry required so much energy and effort.
April Gussler contracted COVID in November. She was hospitalized for 5 days.
Brain fog is a huge thing. I keep forgetting things. I'll forget to put my car in park. I'll put things in the pantry like salad. I'm like, that goes in the fridge. Okay. Muscle aches and pains. My lungs still aren't 100%. I would say they're close.
Michael McGurn has been on oxygen ever since leaving the hospital in August. He was hospitalized for 85 days.
I could be on oxygen up to a year, if not more.
Michael is also working on his lung capacity. Right now, he's in pulmonary rehab.
The hope I have now is I get back to normal. I'm almost back to normal. It's a slower process than I want, but it takes work to get better, and I'm putting in the work.
Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. New Hampshire Bureau of Infectious Disease Control Chief answers COVID-19 questions. Let's take a listen to that video from WMUR News 9.
Quirk works for you at Quirk Kia in Manchester, our dealership at your doorstep. This month, you can lease the new 2021 Kia Sorento LX for just $259 a month, and Quirk will deliver to you. Visit QuirkKiaNH.com.
With Phase 1B of COVID-19 vaccine distribution underway, many people want to know when more appointments will open and how the state will make sure everyone gets their second dose within the recommended time frame.
So we asked you to send in your questions for Dr. Beth Daly, the chief of the state's Bureau of Infectious Disease Control. She is joining us live now to answer all of your questions. Thanks for being with us, Doctor. Let's get right to those questions because we have so many. And the first question comes from Scott. It's one of dozens on this same topic. He says, my first COVID vaccine was administered in Nashua. Went great. Kudos to the team. The second series of the appointment isn't available for 8 weeks. Will that be a problem with the effectiveness for the vaccine?
Great. So good afternoon, everyone. And thank you, Scott, for that question. It's a great question. I'm glad that you did have a good experience getting that first dose of vaccine. We want everyone to get vaccinated in that recommended interval. And for the Moderna vaccine, that's 28 days after the first dose, and the Pfizer vaccine, that's 3 weeks after the first dose. And CDC has come out with some new guidance saying that you can actually receive those doses up to 42 days after you've received your first dose. However, if you do miss a dose and you get it late, there's no reason to be concerned with that. You don't have to repeat the series or repeat your first dose. So that's all great. With that said, we absolutely want to get people vaccinated within that recommended time frame. And we have second dose appointments that will be coming available. These are specially set aside appointments. We have enough vaccine to vaccinate everyone with their second dose. And so we're going to be rolling out these special clinics for second doses very soon. So if you've already gotten that first dose, we will be communicating with you very soon about how you can access these second dose appointments and get vaccinated within a more reasonable time frame than 8 weeks out. So please be patient. We'll be communicating with you soon if you're one of the many people who have found yourself in this situation, and we'll get you moved up.
And Dr. Daly, we have had so many people ask this question. Many point to one of the vaccines makers, Moderna, saying the only data they have on the effectiveness of the vaccine are tied to that 28-day timetable for Moderna. DHHS is confident that it will still be effective if people aren't able to get it for a few weeks after that. Where do we stand on this?
Sure. So the manufacturers, of course, are going to refer to the actual data that they have. These vaccines were studied in a very specific way with a certain dosage in certain intervals, and so they can really only speak to what has exactly been studied. However, we have decades of experience vaccinating individuals, and like all other vaccines, like the MMR vaccine, hepatitis B, hepatitis A, if you don't receive that vaccine in the recommended time frame, you still can receive the vaccine afterward. And, we're not concerned by that. But again, it's not, our goal is to get you vaccinated in that right time period. And we have a plan in place to do that. And we have the vaccine available. So you shouldn't worry. I know there's a lot of concern about this, but we have vaccine. We will get you into those earlier appointments, and you'll be receiving that communication from us very soon.
Very good to hear. All right, let's move on to the next question. This one from Peter, who says, I've been fully vaccinated, but I'm told that I could still be infected asymptomatically and also transmit COVID to another person. When will we know that such spread will not likely occur among people vaccinated?
Sure, that's a great question, and another area that's under very active study by the individuals who study these vaccines to see if individuals can go on to have that virus up inside their nose and be able to transmit it even after they're vaccinated. We know that these vaccines are very effective, 94% or 95% depending on the formulation, and they are effective at preventing you from developing COVID-19, right? So we don't have data about whether or not you can still be exposed to the virus even after vaccination, and that virus could live up inside your nose and be transmitted to others, which is why right now our guidance is still that we do need to be taking these COVID precautions, wearing masks and social distancing as we learn more about the vaccine and how it's performing in terms of actually reducing that transmission in the community.
Here's one from Carol. She asks, if you have a slight cold, should you get your vaccine?
You should not get vaccinated if you are sick. Number one, you could have COVID-19, and we don't want you to transmit that to the people vaccinating you or to other people at the vaccination clinic. And so, no, if you're sick, you should not get vaccinated.
Thank you, Dr. Daly. We have more questions coming up right after.
Okay, and there you go. Good questions there. And if you want to see more of those questions, we will share this link with you on the Riley King Network Facebook page right after this broadcast. Dow futures drop more than 300 points as volatile Wall Street week continues. U.S. stock futures moved lower in early morning trading on Friday as Wall Street's volatile week continued. Biden to expand Affordable Care Act enrollment aimed COVID-19. Let's take a listen to that video from ABC News.
Amid this pandemic, President Biden taking executive action today to expand health care access, reopening the enrollment period for Obamacare to help struggling Americans. Here's ABC senior White House correspondent Mary Bruce tonight.
President Biden today signing an executive order allowing millions of Americans to sign up for Obamacare in the middle of the pandemic.
To undo the damage Trump has done.
The order opening a special insurance enrollment period from February 15 to May 15. It comes with Biden focused on selling Congress on his massive nearly $2 trillion COVID relief bill, which includes $160 billion for vaccinations and testing, support for small businesses, and $1,400 direct payments to most Americans. Biden wants to pass the bill with Republican support, but GOP lawmakers say the price tag is just too high.
If our Republican colleagues decide to oppose this urgent and necessary legislation, we will have to move forward without them.
The White House today asked whether they would be willing to break the bill into pieces to allow votes on the parts with bipartisan support. Their answer, no. In the Oval Office, we asked the president directly. Do you think getting COVID relief passed will require you to break it up into chunks, Mr. President?
No one requires me to do anything.
Saying it's not required of him. Mary Bruce with us live at the White House tonight. And Mary, President Biden says this is a national emergency, that it can't wait. But as you report here tonight, Republicans and Democrats still seem far apart. So what's the bottom line?
Well, David, the talks continue. I asked the White House today, what's more important, getting this done quickly or getting Republicans on board? And they still insist they can do both, that this is part of the negotiating process. But the big picture here, David, if they make too many concessions to Republicans, they could risk losing support from Democrats. And with that near even split in the Senate, they just don't have a lot of wiggle room here. David.
Millions of Americans are watching it all. Mary Bruce tonight. Mary, thank you.
Hi, everyone.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. Thank you for watching. Have a great rest of your day, and I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.